Is this truly the best option? I don't know. Like this? I don't know. We'll work with it. It seems to be. Okay. Welcome back, or welcome if you are new to another video. My name is Giselle and I am so happy to have you here with us. And as you might have been able to see from the title, this video is going to be a Q&A, specifically about disabilities. I posted a YouTube short and I asked you to send me your questions, and here they are. I have about 30, I believe it's 29 questions. And I did actually send those questions to somebody from a different colony. As I said in previous Q&As, that I like to get you the best answer possible. And with me sending your questions to somebody else to answer, it's kind of like somebody else is speaking through me to you. So these are the questions and these are the answers. So are you ready? Without further ado, and before I talk too much yet again, let's just get into the video. Grab your tea or your coffee. I've already had both, so I'm gonna go with nothing. But anyways, let's just get into the video. Number 1, how do you help adults with autism deal with their disabilities? Do they get jobs assigned, and if so, what kind? Autism, like any other disability once diagnosed, would be dealt with care, love, and compassion. If professional advice, help, or diagnosis is needed, it would be tapped into and supported by the colony. Question number 2. How does a Hutterite colony adjust when someone develops significant health problems or disabilities where they might at times not be able to help with work? Hutterite colonies take care of their own from cradle to grave. In very rare occasions, a disabled person may be placed in a personal care home if, for example, no other accommodations for safe and effective care could be made for that person on the colony. For instance, an adult may be placed in palliative care and not taken care of at home because of medical equipment, such as respirators, or if a professionally trained caregiver is needed. At all times, every effort is made to keep and care for the individual at home. Many times, home care, depending on the area, becomes a very vital option. Number 3, how are IDD children and adults integrated into the colony? IDD being an intellectual or development disability. They are treated just like any other member, with respect, dignity, and compassion. For instance, in one colony, an adult female who was IDD challenged was trained to be the janitor in the colony school. She served in this capacity until her physical health no longer allowed her to do this work. She was treated as a member of the school staff and team, and was even included in meetings and on staff trips and outings. Number 4, how does the colony deal with mental illness, depression, delusion, dementia, schizophrenia, Alzheimer's, and the like? All illnesses on all colonies are treated according to professional instruction and suggestion. In terms of mental illnesses, Hutterites will admit members, if needed, into mental institutions that deal specifically with mental illnesses. Alzheimer's patients are taken care of at home by family and community members on a rotational basis. In most cases, home care is also utilized when needed. In some instances, such as end-of-life scenarios, members may be admitted to the local hospital simply because the professional medical equipment and personnel are more readily available. How do you deal with people that have mobility issues in their own home? Colonies modify, remodel, or build from scratch handicap-friendly homes that are equipped with the latest and most modern handicap equipment possible. Does your colony take care of the ones that need nursing full-time? Yes, our colony takes care of all people, including those that need nursing full-time. However, in rare occasions when all other avenues have been exhausted, along with home care, etc., an individual may be moved into a palliative care facility at a local hospital or a nursing home. Number 7, I know it has been referenced that emotional struggles can be dismissed by elders within Hutterite communities. How do you feel about that? Also, is the colony looking to shift their perspective on these things? In some Hutterite colonies, emotional struggles can be dismissed not because of a lack of care, but rather due to a lack of understanding on the part of colony members, elders, or colony management. Emotional struggles like mental illnesses are sometimes hard or even impossible to detect until the problem becomes excessively obvious or persistent. There is a big shift to the thinking perspective on these things, and I contribute to that education. In Manitoba, most colonies require their children to graduate with a minimum grade 12 or high school. Many, if not most, colonies have members of their own colonies as university qualified and trained teachers working in their schools. And a few colonies now have registered nurses who either work in the local hospitals or just stay on the colony. So mental illnesses and emotional struggles, I believe, are noticed or diagnosed quicker and with more professionalism. Question number 8. I was wondering how arthritis gets treated. Do people get joint replacement if needed? And does someone come to the colony to help with physical therapy after surgery? And how do they deal with the workload that you have? Yes, joint replacements if needed get treatment, and on our colony alone there's at least 4 people or more with knee or hip replacements. Physical therapy is done at home or at the local healthcare facility if needed or requested. Number 9. If someone had dementia, would they move in with family members or do all members of the colony assist? Dementia patients, along with all other patients, are taken care of at home as long as possible. Many times local home care nurses come in to assist, and in some cases, if the patient is too distraught, confused, or hard to transport, a physician or nurse practitioner will make visits to the colony for diagnosis, prescription meds, or to see if any medical device could be placed in the home to assist the caregivers. However, as mentioned before, in some instances, the patient will be admitted to the local medical facility. Number 10. How do you accommodate psychiatric disabilities? Psychiatric disabilities are accommodated and taken care of based on the professional advice of the physician. Patient safety and the safety of the members of the community will always be considered and looked at. Are disabilities viewed negatively or differently if they prevent someone from participating in the communal work? Disabilities are viewed as any other illness. Disabled people are integrated into colony life as much as possible. There is always some meaningful task to perform for the members of the community, be they wheelchair bound or whatever the case may be. Every effort will be made to make the member feel valued, loved, and contributing in his or her own special way. Question number 12. How common is it for a Hutterite colony to have someone on the colony that is disabled? I haven't seen any videos yet showing a disabled person physically or mentally, and I'm curious how often this happens in your demographic. I'm not sure if there's any real statistics available on the demographics of disabilities on Hutterite colonies, but some colonies have none, while others have 2, 3, or even 4. And also, majority of our people are not comfortable being on YouTube, which is why I've never showed anybody even with a physical disability, because they are not comfortable being online, and I respect that. Number 13. If someone needs treatment exceeding what the community can offer, how is that managed? But if treatment exceeded with what we can offer at home, along with nurse practitioners and home care, then the person would be transported to a medical facility. However, I should add that this person would have assisted round-the-clock care from a family member or a community member at all times, providing the facility can accommodate that request. Number 14. If someone had severe autism and needs round-the-clock care, would someone on the colony care for that person, or would a facility be thought about? Question number 13 and number 14 go hand in hand. It gets treated the same. Number 15. I have a little boy born without a right hand. How would your colony account for that in terms of assigning jobs, and would the colony get a prosthetic if he wanted one? Your little boy would be given every opportunity and options as he would have in any other community, town, or city. Question number 16. Since schooling is done on the colony, what happens if a child qualifies for additional support such as OT, PT, speech, autism, ADHD, etc.? The same as in any other school. Additional professional support would be made available to that student just as in any other school. However, in some colonies, if a student is severely challenged in any of the above diagnoses, the colony would provide additional support if the division or jurisdiction does not or cannot. Number 17. People who become disabled through an accident or illness, how are they treated? They are treated as any other member. They would receive care and be given every opportunity or training possible to help them become contributing members of not only the colony but also society as a whole. For instance, a young Manny, paralyzed from the waist down, may be trained to operate the colony's accounting or engineering software. It all depends on the individual's wants and needs. Question number 18. Do you make your own prosthetics for people having very bad accidents around the farm and such, or specially assistive items and machines for around the home, or do you rely on regular medical suppliers? All medical devices needed or prescribed by a physician are bought professionally from suppliers recommended by the healthcare profession. Number 19. Do Hutterites have specific generic diseases? We have our generic diseases such as MD, MS, and LAS, although I'm not sure those are unique to the Hutterite faith. Question number 20. Are people in wheelchairs encouraged to join in with everything? Meals, work, etc. I have never seen anyone in a wheelchair in your vlogs, and I am sure there must be some. All people, including physically handicapped, be they wheelchair bound or otherwise, are strongly encouraged to participate in all colony activities, especially community meals, celebrations, and religious services. Question number 21. Do you recognize menopause as an illness, and do the ladies get to talk about how they feel? I know how sick it can make you. Is it okay to talk about such things? Some ladies, just like in every culture or faith, are more open to discuss issues such as menopause than others. Professional medical help is just a phone call or a short trip away. Question number 22. I'm interested in how Hutterites view mental illness, like depression. Do you, like some people, believe it can be prayed away? No, not all depression or mental illness can be prayed away. That would be a very naive thought. Professional help is needed and tapped into whenever the need arises. Question number 23. How are cognitive impairments recognized? Would someone born into the colony with Downs or a similar impairment be assigned the same sort of communal work? Would they be taken care of by the community if their parents passed before them? They are taken care of just like any other member of the colony, and every effort is taken to include them in meaningful community work and activities as much as possible. Okay, where are we at? I had to quickly charge my battery for my camera. Number 24. If you have an autoimmune disease such as fibromyalgia, arthritis, etc., are you still expected to work full days? Every member, regardless of age, ability, disease, or sickness, is only expected to contribute what they physically and mentally can. That's why community life is so wonderful and in a way beautiful. You are taken care of from cradle to grave. Number 25. Are any members of your colony or others educated in special education? Yes, most colonies in Manitoba have university-trained teachers from their communities teaching in their schools. Yes, male and female alike. Question number 26. I'm in a wheelchair. I love to cook. Would it be possible for someone like me to take a turn in the kitchen rotation? Yes, your help would be appreciated and loved. Number 27. I'm chronically ill and disabled, and I think I would feel very guilty towards my colony should I live in one, because I can't do a lot of work. My medical expenses are higher, and others would be obligated to help me next to their normal work. That is what community life and care means: taking care and working for those who can't. Number 28. Does the community have much lower rates of all mental health disabilities, from depression to ADHD, anxiety, behavior needs, etc.? We do have children with ADHD and anxiety and behavior needs. In our colony and a few other colonies that I spoke to, there are none. But then you also have to remember, those are schools with a total population of 35 students each, and that is from kindergarten all the way up to grade 12. Question number 29. What do the Hutterites do about blindness? People who are born blind or going blind. We would tap into any resource available to us to help this person become a contributing member of society and the community. And that's it. I hope that a lot of your questions are answered and also gives you a better understanding. I will see you in the next one. Bye.